Hi, welcome to Nursing Perspective. My name is Brenda Reed Thompson. I'm a nurse, and today I'd like to talk about the flu since it's been such a serious health problem and it's expected to be around through March. So here are the two issues I'd like to discuss. How do you know if you have a cold or the flu, and how can you protect yourself from the flu when it's spreading like wildfire? First, let's talk about the difference between cold and flu. If you have a cold, you will have a sore throat, cough, runny nose, nasal congestion. If you have the flu, you may have those same symptoms, but you will also have things like muscle ache, headache, fatigue, fever, weakness, sometimes vomiting and diarrhea, although that's more frequent in children. So now let's talk about how can you protect yourself. If you have not gotten a flu vaccine, do so. Data has shown that all strains of the flu have been documented this season. The vaccine has been more effective against the H1N1, which is a strain of the A virus, and both B virus strains. Now here's the problem. The vaccine has limited protection against the H3N2, and that's the virus that is widespread at this time. If you did receive the vaccine and you get the flu, you may have a milder case. Pregnant women should get the flu vaccine because antibodies will be passed on to her developing baby and will protect the baby against the flu for the first several months after birth. The infants will then receive their own flu shot at 6 months of age. The other way you can protect yourself is by hand washing. Anyone in healthcare will tell you that hand washing is the single most effective method to prevent the spread of infection. Wash with soap and water for 20 seconds. So 20 seconds could make the difference between becoming ill and staying healthy. Come on now, let's think about this. If you wash your hands 6 times a day, that's only 2 minutes out of your entire day. Use alcohol-based hand sanitizer if water's not available. Another thing you can do is to avoid touching your face unnecessarily. Respiratory viruses have been found to enter the body via the eyes, the nose, and the mouth. The other thing you should do is sanitize high-touch areas, and we all know what they are: the phones, the remotes, light switches, doorknobs. If you are sick, how can you prevent spreading the flu to others? So let's think about this. If you're sick, you should probably stay home. If you have a cough, cover that cough. Use a tissue. You can also use the bend of your arm to prevent transmission. Flu is spread by droplets, and droplets from a cough and sneeze, believe it or not, can spread 6 feet. Some teachers have demonstrated to children how droplets can spread by using a spray bottle and a paper plate with a face on it. When you pull the trigger, children can actually visualize how important it is to cover that cough. Do not cough into your hands, okay, since touching objects with unclean hands will spread the virus to others. Now, these practices are necessary to decrease the spread of the flu. So let's decide right here, right now, to make an extra effort to protect ourselves and others from the flu. Please share on this site which interventions are being used in your school, church, daycare, work environment, or in your home to decrease the spread of the flu. Let's share ideas. My idea is for moms. Text your children. As you can see on this board, I have a few acronyms. Wash your hands. Avoid touching your face. Cover that cough. I'm looking forward to hearing from you. Please share your ideas. The purpose of this video is to share information. It's not intended to be a substitute for seeking medical advice, diagnosis, or treatment. Thank you for listening.